The Victorian Government will invest up to $295 million to expand Dandenong Hospital's emergency department if re-elected. 2 new floors will be built to increase its intensive care and outpatient capacity. Speaking at the newly built Heart Hospital, Premier Daniel Andrews says the investment will help the health system meet demand.
What it means is some 12,000 extra patients each and every year being able to get care at the Dandenong Hospital Emergency Department. There's 750 construction jobs in that important project as well. It'll begin next year and it'll be concluded as quickly as possible. We think around 2026, perhaps a little bit longer, just depends on final design and final detail, but it is exactly the right step to take.
Meanwhile, Victoria's health system has been dealt another setback. The federal government's recent budget could see the state system lose $1.4 billion of federal funding. Holly Edwards-Smith is in Melbourne. Holly, what is the timeline of these cuts?
Danica, budget papers do indicate that $1.4 billion of federal funding will likely be slashed across the next 4 years. $645 million of that will be lost in the next financial year, with subsequent cuts of between $450 and $480 million. This is another blow to Victoria's already struggling health system. The analysis of the budget comes just 6 weeks after a damning report into Victoria's 000 call system found that at least 33 Victorians died while experiencing delays in services, and currently for a period in August of this year, ambulance response times were up 2 minutes from when the Andrews government was first elected back in 2014. Health has been a major issue in the lead up to the state election, and with this announcement of funding cuts, Daniel Andrews, the Premier, didn't welcome it, but he did say that the Albanese government has already done a number of extensions on this arrangement, which has helped the system, and it's something that will be negotiated.
Scott Morrison had indicated that this funding would end months and months and months ago. The Albanese government extended it out until the end of the calendar year. And we covered that at the time. I talked to you guys about it then, and we were very grateful. And on that day, and again today, we indicate that 50-50 is what should be the ongoing arrangement. But those arrangements are not due for renegotiation until 2025. In the meantime, we're pushing as hard as we can and working constructively on some really significant improvements to our Medicare system.
Danica, as I mentioned, health has been at the forefront of both major parties' campaigns in the lead up to November 26. Today in Melton, on behalf of the coalition, Liberal leader Matthew Guy made a number of announcements, but also criticisms of the Labor government and their handling and spending on Victoria's health system. One of their major points of difference is in relation to public transport and how that will impact health spending. Matthew Guy says if the coalition is elected in November, they will shelf the suburban rail loop and instead use every single cent of that funding towards improving Victoria's health system. Matthew Guy says that this announcement that federal funding will also be slashed is just another blow.
Makes it harder when the federal government ripped $1.5 billion out of Victoria's health system. It makes it harder when the Labor government ripped $2 billion out of our health system. It means that an incoming government that I lead has to reprioritise money from the suburban rail loop and put it all into health, because that's where it's needed the most.
Today, Matthew Guy has criticised the Labor government in regards to health announcements in Melton, saying that some of the $1 million of funding there are a waste and can be used for other services, including fire stations and upgrades in those areas. Matthew Guy also made an announcement, $1.5 billion towards public transport in that region. There is just about 4 weeks until the state election here in Victoria on November 26, and health remains a steady focus for both major parties.
OK, Holly Edwards-Smith, thank you.